In the squat series, we're going to look at regressions and progressions for squatting patterns. Squatting is probably one of the most important movement patterns in relation to athletic performance due to its relevance in jumping and landing mechanics, lowering your centre of mass to decelerate and change direction, but also in the gym in relation to developing strength, in particular in the quadriceps and gluteal muscle groups. In relation to athletic groin pain, we're very much interested in the control of the thorax on the pelvis and the pelvis on the hip. If we have a look at Tommy do a couple of overhead squats here, we'll get an idea of the control elements that we're looking to assess. Number one is the influence or control of the thorax and the pelvis and rib position. Number two is the lumbopelvic control and movement of the pelvis and the hip. And number three is the position of the trunk relative to the vertical and how we can keep our centre of mass within its base support. Common errors we see are excessive rib flare as it comes down into a squat position. Number two is increased anterior pelvic tilt throughout range. Or number three is forward position of the trunk relative to the feet. These are going to lead to excessive load and strain through the anterior pelvis and the muscles that attach to them, earlier dynamic impingement of the hip joint, but also limit our ability to develop the qualities where we want to develop them in the quadriceps and gluteal groups and in the abdominals, maintaining lumbopelvic control. The principal exercise in the squat stream is the front squat. The primary entry point is with the hands on the bar and elbows pointing forward as demonstrated. The three main coaching cues for the front squat are to keep the elbows parallel to the floor and pointing forward, maintain a neutral lumbopelvic position and flex simultaneously at the hip and knees to maintain the centre of mass within the base support with an upright trunk. Common errors are for the elbows to drop forward or splay outwards, to collapse into anterior tilt through range, or to forward flex at the hips, bringing the trunk forward, bringing the weight more over the knee rather than maintaining it over the base support. Again, the key cues are to maintain the elbows pointing forward, neutral lumbopelvic position, and if necessary, using the chair to maintain an upright trunk. To progress, we can go for greater depths or increase the intensity of the weight lifted as a progression.